Hello, everyone.
Hello.
Hi.
Hello, Sharon.
Welcome back.
Today we are joined with Sharon from the Fertility Network. So the Fertility Network is a charity in Scotland. So welcome, Sharon. Could you let us know a little bit about your service and how it works?
Okay, so hi everyone, my name's Sharon from Fertility Network Scotland. I work for a charity, it's a UK-wide charity, however here in Scotland we're branded as Fertility Network Scotland. We've been working with colleges and universities now for 6 or 7 years, and part of that is because we do an education programme. Now, fertility is probably not something that students would even consider at the point they
Not
end
necessarily, not yet.
college and university. However, we're trying to get in and reach that age group, because what we find in our charity and our day-to-day work is the number of people who want to settle down and decide to have a family. They find that they've got some underlying reason why they can't have a family. And sometimes time's really running out by the time they actually discover that. And sometimes some of the reasons why they can't have a family is because of perhaps lifestyle choices they made as students. So we're trying to probably prevent people being in the situation where they actually need help to have a family through any sort of interventionist treatment in relation to fertility. Probably people will be unaware that 1 in 6 couples seek medical intervention when they're actually trying to have a family. For many, it's really, really easy, but for others, it can be a real struggle. And the mental ill health that goes with infertility is extremely significant. And so that's why we're trying to reach young people, and hopefully we can maybe, help young people understand just some lifestyle factors that could affect their future fertility.
Okay, that's really interesting. So what, for example, what services is it that you deliver so concretely to students, and how can they get in contact with you? What sort of specific support do you give them? So you educate them on these lifestyle choices. What does that entail?
So as I said earlier, we're not here to, preach young people about their lifestyle choices. We're just going to give them that information. And we love coming along to freshers. We've usually got one of the busiest stalls at any freshers events we attend. We've got loads of freebies. We love playing games with young people. But at the end of the day, what we're there for is just to try and just leave a wee chunk of information about, probably one of the biggies is STI infections, and something that's, students might be aware of, the risk of getting those sexually transmitted infections, but what we're trying to just give them that additional information. Something like chlamydia, it's probably one of the most prevalent STIs in the UK, and for quite a significant number of people, they have no symptoms, they don't know they have it. However, it can take something as short as 3 weeks for a female to be actually made infertile as a result of that STI. And what I mean by that is they could end up with scarring in their fallopian tubes, and that scarring would actually stop them being able to conceive. And quite often, it can be 10, 15 years later, they could be in their mid to late 30s, and they're starting to, think, why am I not having this baby that we're trying for? And that's when they discover that when they get various tests and examinations, that they've got scarring internally, and that's most likely caused by an STI that's not been noticed, or even one that's been treated late. So that's the sort of information we talk to students about. We talk to them about weight. Weight's a huge factor in fertility patients. You can't access fertility treatment even if you need it if your BMI is over 30. So we talk to young people, this is for everything in life. Remaining healthy is good for your health, but it's also really good for your fertility. We talk to, we like engaging with our sporty youngsters. It's become more and more prevalent that youngsters are taking anabolic steroids. And they can have a huge impact in male fertility. So a lot of people think that fertility or infertility is a female disease. However, the statistics shows that when people go forward for fertility treatment, it's 37% male factor infertility. So, it's not a female disease. It's a disease that affects all people equally. So, we talk to you, particularly boys, about the impact that anabolic steroids have on their sperm count. And even after stopping taking those anabolic steroids, it can be just a phase in their life where they want to gain muscle mass quickly and they're talked into it by friends. It can have really lasting impact on the fertility. Similarly, we talk to girls about eating disorders and the massive impact eating disorders can actually have on their, fertility cycle, their menstrual cycle, and it's linked with other disorders like polycystic ovary syndrome. We talk to them about smoking. We bring along games usually to get over the impact that alcohol can have on your lifestyle. So we get the youngsters to, or the students, sorry, to fill up and let's see your home measure of whatever spirit you take. And it's fun, and we let them keep the cups that we use. You've probably seen them, the alcohol measuring cups. I don't think I've met a student yet that can show me what a pub measure actually looks like in one of those cups. So it's fun. One of the things I think that a lot of people are still not aware of, because we do during actual physical freshers get the students to fill out a survey, and we collate that anonymous data. But one of the key questions we ask is, what do you think the underlying reasons that could impact your future fertility? And number one is smoking, and that's probably because the messaging that governments and health boards have got across to young people about the impact of smoking. And yes, smoking can have an impact on your fertility, but probably one of the biggies it's never really talked about. And I think last year the survey we done, and we had over 2,500 students completed the survey across Scotland. I think only 1 or 2% recognised age was a factor. With young people, particularly females, because that's the big factor with females. Because it costs so much to get their own house nowadays, and they stay at home longer, they take longer to get into the, meeting the partner that they want to have a family with. Quite often people don't actually start thinking about having a family till their mid to late 30s. And unfortunately, females' fertility actually starts to really sharply decline after the age of 35. And really, we describe it falls off a cliff at 42. And probably that's the kind of age group that we're constantly engaging with, people who are in their mid to late 30s that, and they're honest with us, they tell us they just weren't aware. And you would think, in today's society, that would be something that's quite commonly known, but it actually isn't. When our students are telling us they think age is a factor in only 1 or 2% of our student population.
Okay, yeah, that's really interesting, and I mean it's good that you're talking about that as well. Because there might be some mature students watching as well that can be in that age range too. So it's not just young people.
Actually, Sharon, you know what? I actually had a plan of taking steroids. That's because I was a professional bodybuilder back then, till 20, and I was more into muscles. I was completely concentrating on my muscles. I thought muscles are life. I thought of taking steroids by seeing other competitors. And then my brother, he's a medical student. I had a word with him before taking that. And he told me about all the side effects, about the fertility, everything. And then that made me drop from those plans of taking steroids.
Yeah. It's really, I speak at student events all the time, and particularly with sports students. You can actually see in their face, they're like, they just didn't realise the lasting impact it can actually have. And it's really sad that messaging just doesn't seem to be getting out to students. And sometimes, when I engage with them at freshers, or I'll go along to like student lectures, I we need to get that message out to them so that they make the right choices, because I can tell you, see at the other side of the main work our charity does, the impact in people's mental health when they have been desperately trying for a family for 2 and 3 years and then eventually get told this is never going to work for you. It's absolutely decimating in terms of marriages break down, the suicidal thoughts that people have if they're undertaking a fertility journey, and they don't get that much long for baby at the end of it. It's dreadful, and it's a hidden area of mental health because people don't talk about trying for a baby. People are getting better at talking about their mental health, but not when it's something is personal or having a family.
Yeah, no, and
As you mentioned
and I
about
think to go back to what we were saying at the beginning about students, protecting themselves from STIs in order to avoid fertility problems later. Can you tell us a little bit about the C card as well? Because I know that that's something that's offered by the NHS, right?
In relation to the C card, that's very much NHS, and that's not something. Our messaging is all about. We're not telling you, you can't be sexually active, because that messaging doesn't work with students. That's their life and it's their choices. But from a fertility perspective, what we say is, if you do happen to have unprotected sex, make sure you go and get yourself tested. That's available through the sexual health clinics.
So so in Edinburgh, where would the students go to get tested for STIs? There's quite a few places. Would they go to their GP, or is there a specific clinic as well?
There's sexual health clinics across the whole of Scotland, including Edinburgh. And if anyone just Google sexual health, it is there and it's available to them to look. Quite often at freshers, I have seen the sexual health teams out. Every health board in Scotland does have a sexual health team, and it's confidential. They don't even need to give their own name. It's not linked back to the rest of the NHS. And these sexual health teams work really well with young people at both educating them, but also ensuring they get the appropriate tests, and if they need any medication, to get that as well. And they also get, free access to condoms to try and reduce any instances of sexually transmitted infections.
Okay, great. Thank you. Now that's quite helpful, and also knowing that these services to get tested for STIs are free as well, and anonymous. I think because that can be some barriers for a lot of people as well. Some people can maybe feel a bit shameful about going. So I think it's really good to emphasize that you can go. No one's going to judge you. You don't even need to give your real name. So I think that's great, and it's a good thing to talk about. So yeah, Sharon, that you've been really helpful. It's really interesting to know about everything that your service can do. So how would the students get in contact with you? Would they go on the website or? So
they can get us at fertilitynetworkuk.org, Facebook, and we're on Twitter. We're on Facebook under Fertility Network Scotland. Now, that's the main part of what charity does, but from a student perspective, this programme is called Your Future Fertility, and we're on Facebook under Your Future Fertility. One other thing that I hope you give me just 2 minutes to mention.
Of course, that's fine.
One of the things that we really look at, and in particular when we're out at freshers, and it's really unfortunate this year that we won't have the opportunity for that face-to-face interaction with students. But one of the things that's grown and grown, is different types of families. And when I say different types of families, I mean we've got a same-sex females, we've got same-sex males, we've got single people wanting them back on a fertility journey, we've got trans people that want to protect their fertility before they go on that journey, and we get an awful lot of inquiries during freshers from students. So this group of students are not thinking about having a plan to have a baby just now, but they like to ask us what is their route way to parenthood at the point in their life that they think they would like to embark on having a family. So we do a lot of engagement with students from all different lifestyles who are thinking about what the future might hold for them. So that's something that we're really proud of in this charity, that we support students all the different types of blended families that you now get, and more students and more young people now are embarking on, and we've got great access in Scotland. You know, people from same-sex couples now get the exact same access to fertility treatment, and our charity was at the forefront at trying to get that brought in, and the Scottish Government have been brilliant, and they've funded, you know, all couples who want to embark on a fertility journey if they meet the criteria. And I've already kind of mentioned and touched on the criteria, like weight's a biggie. So that's something that's really important too. The other thing is our charity are happy to come out. We support you know, the universities and colleges, particularly in health and sports courses that have been undertaken in the colleges and universities. If you want us to come out and even cover the work that we do, we're more than happy to come out, and we can do it by Zoom. Much of the learning this year is going to be blended. We're more than happy to come and support with whatever learning the lecturers might have.
Okay, fantastic. Well, thank you. I think that is all for now. And yeah, and thank you for everything that you said. That is very useful. And you know, if you're a student and if you're interested in this charity, just go and check out the website. And there's a lot of good resources on there. So yeah, thank you to Sharon, and thanks for coming onto our little live stream with us.
Okay, thank you. Bye.
Bye.
Goodbye, Sharon.
Bye.
Well, that was really interesting. So what do we have next? Nikhil, do you want to
wanted to let
at 1:30
yeah, but
we
just
have a
wanted
yoga
to let
session coming
our
up.
viewers know about, we were facing some technical issue that Sharon was there, but we couldn't see her face, but there was technical issue, and we were supposed to be getting another department which was about the print service. Avril was supposed to be joining us, which is again because of some technical things. And I just wanted to let you know about the print service. What exactly the print service is? Print service is students who wants to get their leaflets, flyers, or if any campaigns you're doing, you want some leaflets, flyers. We have this office, print service office as well in Site Hill campus, and you can get your t-shirts as well. They have printed t-shirts with the brand of the university, Edinburgh University. This is what exactly a print service does. I wish Avril could come and tell us that. On top of that, if you are printing your coursework or your assignments, especially dissertations, which you need to print it out and then get it binded. So this is the service which this print office do provide. Nikhil, over to you. Do you want to add anything?
Yeah, so coming up next is the yoga session at 1:30 p.m. So do catch us at 1:30.
Yeah,
Get
in
some
10
books
minutes.
about yoga. And also on the other side, we have a sports and societies fair going on. All the sports and societies are going live on the Facebook pages. So at the moment, we have from the society side, Aeronautics and Rocketry Society, Event Society, Chamber Choir, D&D Society, Yoga and Wellbeing, Beer Society, English Literature at Napier Student Marketing. So they're going live from the society side, and from the sports side, we have American football, men's basketball, volleyball, mountain biking, women's hockey, men's rugby union, and women's rugby will be going live from the sports
Cool.
side. So do catch them all, guys. It's a great opportunity to let them know, and you could get to know their plans for this year. So yeah, don't miss this.
Yeah, that sounds good. A lot of sports and societies. And also after that, we will be coming back at 2 p.m. with someone from security that we'll be interviewing about how you could get in touch with them. We will be interviewing someone from the worldwide Napier language magazine as well. So that's quite an interesting one. And also someone from a charity called Nightline. So definitely stay tuned, and we will see you in about half an hour. So yeah.
Yeah, just want to add up at Nightline. This is about telephone advice and support service for students who are in crisis. So stay tuned and check it out. How does that can help you?
Okay. Bye, everyone.
Thank you.
See you soon.
Bye.